has come to this. South Africa is caught in the second COVID-19 wave, and the healthcare system is taking quite a strain. Over 24,000 people have died since the first case was announced. Our reporters are checking out the situation around the country. Of course, we do have Siphamandla Goke, who is in Polokwane, and Mawande Keswa, who is in Durban. They join me now, of course, to take us through what are some of those details. Colleagues, good to have you, and good morning to you. Sipha, I just want to start with you. You are, I can see there at the Pietersburg Hospital. How is the province faring in as far as the second wave is concerned, as well as healthcare workers at this time trying to manage the situation there?
Indeed, well, we are outside the Pietersburg Hospital in Polokwane, LIMPOPO. Let me tell you that this province is not one of the so-called hotspots when it comes to COVID-19 for now. It's one of those provinces which have been very lucky in terms of having the lowest numbers together with the Northern Cape and Mpumalanga province, but it doesn't mean to say there are no cases here. As of yesterday, if I'm not mistaken, according to statistics, we are looking at about 20,220 cases in total in LIMPOPO, and there is a total number of 526 deaths so far. But that's very low compared to KwaZulu-Natal, Gauteng, Western Cape and the Eastern Cape. This hospital that you're seeing behind me is one of the biggest hospitals in the province. This is where some of the COVID-19 patients are brought, and this is also the second referral hospital in the province. So we are here simply because authorities in this province are worried and concerned about the number of people who will be coming from other provinces, particularly those who are from LIMPOPO, who work in Gauteng. This is the festive season like no other, but people are flocking into LIMPOPO and Polokwane. There is also that aspect of domestic travel or domestic tourism. We all know that this province is one of those most visited provinces during the festive season. So authorities in this province are worried about that, and they are preparing to deal with the second wave. So far, there are no influxes of patients being brought in here, but we understand, as we will be speaking to the health MEC later on, Dr. Popira Matuba, that they are on high alert. But right now, we are joined by LESIBA, who is the provincial chairperson of DENOSA in LIMPOPO. Thank you very much for your time. The second wave, how are your members, nurses, dealing with the second wave here in LIMPOPO?
Thank you very much for having us, Sipo. Generally, our nurses are well alert, despite several challenges that we are having. You are correct to say we are one of the least affected in the country, the second least province in the country. But that does not mean that we don't have some problems and alerts that we must check. Our nurses are very much ready. They are equal to the task. It is just that the department itself is not coming on board as expected.
What is it that they are not doing? What are your concerns? What are your challenges? What do you want the department to do?
No, our challenges, number one challenge, it will be shortage of staff. We are grossly understaffed as nurses, especially as nurses. Despite that, this province is producing a lot of nurses. Only 2 years back, we have got more than 544 professional nurses, highly qualified nurses, who will be assisting us in COVID-19 management. They are at home. They are not being absorbed. I'm talking about the nurses who are trained by this department. But now, they are at home, they are not hired, and we're having a shortage of nurses. So, if the nurses were hired, we will be talking another story. But we just have a problem of their absorption.
Now, those that are working, they are overstretched. I've heard that in the Northern Cape, for instance, nurses are complaining that they are working long hours because they have to deal and cope with the number of patients. Is that the case here? Are your nurses members overstretched?
In LIMPOPO, it's even worse. They are overstretched. We are understaffed. We are a rural province. Secondly, to add salt on open wound, this department has released circular number 43, which prohibits our nurses from doing some overtime, and are now even interfering with off duties of nurses. So our nurses will be more tired than before.
Do you know how many nurses have lost their lives since the start of this pandemic?
We are very lucky in the province because we have lost less than 15 nurses in this province. That's why I say we are very lucky in the province.
In terms of PPE, earlier on there were concerns with the quality of PPE that was provided in Limpopo. Has that changed?
This is a national issue. We cannot say in Limpopo we are immune to that. It's just that as the union, we are putting a very open eye and watching the department and putting the department on board so that we are not compromised and our members are not compromised.
Okay, Baba, thank you very much for your time. That is LESIBA MONYAKI, who is the provincial chair of DENOSA in Limpopo province, as we continue to explore the second wave. Later on in the day, we will be speaking to the health MEC in this province, Dr. Poppy Ramathuba.
On that note, let's move on now to KwaZulu-Natal. My colleague Mawande Kezwa is standing by in Durban. Mawande, contrary to Polokwane, KZN is one of the hotspots in as far as provinces are concerned. How are hospitals there faring?
Good morning. Well, we are looking at a situation where there are about over 154,000 confirmed cases in KZN. Now, on a daily, we've been recording an average of over 2,000 new infections. And this has contributed to the spike in the number of infections as well as the people needing medical assistance, particularly in the private healthcare sector. And in that sector, you're looking at a situation where there are over 1,500 patients that have been admitted. This has led to reports received recently stating that some patients have had to be diverted and pointed to other hospitals within the private sector as a result of not having any bed availability. However, when we spoke to the MEC for Health in the province, NOMAGUGU, SIMELANE-ZULU, she said that there's no cause for panic as far as the availability of beds in the province is concerned. Let's listen to what more she had to say.
We are quite ready for the second wave. We are ready in relation to the bed availability as well. We currently have more than 3,000 beds available. Remember, when we were first hit by COVID-19, we had to repurpose some of the facilities that we have, and that was an investment that is permanent within our own facilities all over the province. We had to put up, or we did put up, 4 what we call field hospitals. One is in King Cetshwayo, which is in Gwelizane Hospital. The other one is in General Kizenga Mpanza Hospital, which is in Ilembe. And the other 2 are in Clearwood Hospital, eThekwini. Now, of the 2 that are in eThekwini, we get more than 220 beds out of that, and 113 in each of the other ones that I've counted.
Well, Mawande, we're seeing there, of course, the MEC speaking about beds, but it seems that that will still be a priority for the province, given that filled hospitals might still be a need for the province to accommodate those infections.
That is the case. The province puts a lot of impetus on the situation around the setting up of field hospitals. Now, some hospitals were refurbished. MEC did speak about the Clearwood Hospital for one, which we visited several times. So in terms of bed availability, there's no alarm that she's sounding. And those beds, along with the field hospitals, were open for both people utilizing private and public healthcare system. So it's something that will assist the health sector as a whole. So the MEC also did speak to the return of other field hospitals, because at the time they were created temporarily for the demand, and as soon as it dropped a bit, some of them may have been decommissioned. But let's take a further listen to what she had to say about that.
We also had beds that were in outside facilities that were owned privately. In other words, we rented hotels, lodges, and so forth. So right now, we are looking at whether we need to get into that. We might have to, especially for those patients that are not really sick, but they just want to be close to a hospital and they want to be under some supervision. And we will then get into a contract with some of those facilities. The reason why we've decided not to get into contracts with all of them wholesale throughout the province is because we've learned quite a few lessons over the year. When we peaked in July, we got into contracts, or we engaged ourselves in contracts that were much longer, and it became very difficult to get out of them. Some of them were not utilized to maximum capacity. So right now, we are being very cautious on the nature of contracts that we are getting into, but we are also being cautious in relation to the need. So we will be getting those contracts according to the needs, and that is how we are going to be extending or increasing our bed capacity.
All right, MONYAKI, thank you so much for those updates this morning, colleagues, as we leave our conversation for now. But later on